Are you tired of knee pain dictating your life? What if I told you that there could be a way to dance away from surgery and save your hard-earned money? Stay tuned as we expose the secrets to beating knee replacements and taking control of your health. Did you know that every year, an astonishing 790,000 knee replacements and 450,000 hip replacements are performed in just the United States alone? With such staggering numbers, it's easy to think of this procedure as an unavoidable part of life. But here's a question to ponder. Is it really necessary to go under the knife? Surprisingly, your muscle strength, especially in your quadriceps and hamstrings, plays a pivotal role in determining whether or not you'll need a knee replacement. With proactive exercises and a few lifestyle changes, you could potentially save over 50% of patients from forking out a hefty sum ranging from $30,000 to $50,000 for knee replacements. Proactive exercises could potentially save over 50% of patients from drilling their wallets for the hefty cost ranging from $30,000 to $50,000. Surprisingly, diet changes, exercise, weight loss, these low-cost interventions could prevent joint replacement, but clearly a healthier menu isn't a big revenue source for medical institutions. So let's dive a bit deeper into these alternatives, shall we? Imagine a study involving 100 patients, all eligible for knee replacement. Over a 2-year span, every single one of them showed improvement. And here's the kicker, not all of them went under the knife. Some opted for non-surgical methods like exercise, diet changes, and pain medication. The results were just as promising, if not more. Now ponder on this for a moment. What causes most knee pain? Overweight, muscle imbalances, injuries, all culprits that a shiny new knee won't necessarily fix. So if the root of the problem lies elsewhere, why focus on replacing the knee? It's just like painting over a water stain on your ceiling without fixing the leak. It might look better for a while, but the problem is still there, and it's bound to get worse over time. Similarly, a new knee might give temporary relief, but unless the underlying issues are addressed, the pain is likely to return. And this is where diet, exercise, and weight management play a crucial role. A balanced diet not only helps in weight management, but also provides the necessary nutrients for joint health. Regular exercise, on the other hand, strengthens the muscles around the knee, thus providing better support and reducing strain on the joint. Now, don't get me wrong, I'm not saying that knee replacement doesn't serve a purpose. There are cases where it is the best, if not the only, solution. But before you decide to go under the knife, it's worth exploring these low-cost interventions. From eating well to maintaining a healthy weight, and yes, yoga and physical therapy, these could save many from the operating table. So let's kick the knee pain to the curb with lifestyle changes. Your wallet will thank you, and so will your knees. Let's fight the knee pain with lifestyle changes instead of falling into an avoidable net of surgical complications. It's your health, your money. Make the smart move. By adopting a proactive approach towards your knee health, you not only evade the potential risks of surgery, but also save a significant amount of money. Imagine what you could do with $30,000 to $50,000 saved. The benefits are not just financial. A healthier lifestyle, including a balanced diet, regular exercise, and weight management brings far-reaching benefits to your overall health. It's like hitting 2 birds with 1 stone, improved knee health and a healthier you. Remember, the power to change your health trajectory is in your hands. Start today, and you'll thank yourself tomorrow. That's it for today, folks. If you found this information helpful, don't forget to like, share, and subscribe for more such enlightening content. Stay fit, stay informed,